Hello, this is Dr. Jim Keel, and welcome to Dr. Keel TV. Today we're going to talk about periodontal disease. A question that we get a lot at the office is, what actually is periodontal disease, and how is it treated, and is this something I really need to worry about? In general, people only lose teeth for two reasons. The tooth breaks, or the supporting structures around the tooth break down. That's the gum and the bone. And that's really the area that periodontal disease affects, is the gum and the bone that support the teeth. So first, let's take a look at how the tooth is actually supported in the mouth. You can see from this picture that the tooth in the mouth is supported by three things: the gum, the bone, and a periodontal ligament that runs all the way around the tooth. As the periodontal disease process starts, plaque and tartar builds up on the tooth, and this causes inflammation, which causes bone to be destroyed. In this next picture, you can see a very important aspect of periodontal disease, and that is, as the disease progresses, the measurements taken around the tooth and the supporting gum and bone begin to melt away. You can see on the right-hand side of this picture a healthy situation where there is about 1 to 3 millimeters of gum above the bone. On the left-hand side, you can see an unhealthy situation where that measurement is clearly increased. This also shows another important aspect of how periodontal disease is diagnosed, and that's through the use of a periodontal probe, which is nothing more than a small round ruler. This measurement measures from the top of the gum line to the top of the bone. And again, in healthy teeth, we see this to be anywhere from 1 to 3 millimeters. If these measurements are increased or there is bleeding present, these are the first early signs of periodontal disease and require treatment. Treatment of periodontal disease falls into two broad categories: surgical and non-surgical treatment. If probing measurements are anywhere from 4 to 6 millimeters, patients respond generally well to a non-surgical approach. This requires some initial visits of scaling and root planing, which is a deep cleaning. After that, followed by close follow-up for at least a year to make sure that the disease process does not return. If probings are anywhere from 6 to 8 millimeters, this generally will respond to a combination of surgical and non-surgical approaches, and above 8 millimeters generally will require a surgical intervention by a periodontist. Another important aspect of treatment, we oftentimes get the question, how important is this? Is this just about my teeth? And it's not. In recent years, there's been a lot of evidence, scientific evidence, to point to the fact that periodontal disease and overall health have a strong relationship. In fact, as we said earlier, the bacteria that cause periodontal disease are often found throughout different areas of the body. These have been linked to stroke, cardiovascular disease, low birth weight babies, and a variety of other conditions. So you can see it's important to have that periodontal disease treated as soon as possible. Thank you very much. I hope you enjoyed today's blog. Next week we'll be talking about dental implants. Thank you.